And so tell us a little bit about, because again, the LSVT program, what are the really, like, if somebody's going to work with patients with Parkinson's or is interested, and I know it's also, from what I understand, it's definitely something that can be used with other populations. I know clinicians that use it with there are patients that have Down syndrome, or I've heard of, even now they're doing an LSVT for kids, which I just saw advertised. But if somebody says, you know what, I really am interested in working more with this population, I do know I need some training. Tell us what it is about the LSVT program that really you feel like, why is it so effective? And so like kind of a must do if you're going to work with them.
Yeah, if you're going to work with Parkinson's, absolutely LSVT or Speak Out. I'm not LSVT certified. I did some work with it when I was in graduate school, but that's pretty much the extent of it. I am a Speak Out provider, though.
Okay.
But I do know the differences between the two. So they're both intensive. Speak Out is fewer sessions, which can be nice to fit into people's schedules. And Speak Out incorporates cognitive exercises, which LSVT does not. But they're both, so we kind of have to talk about the cause of Parkinson's if you want to know why these work. So should we kind of go over that?
Yes, really please give us the high level overview of what is even happening to cause this.
Yeah, I think that's helpful to understand that first. So we all know about the dopaminergic neurons that are dying, and this is substantia nigra. We know there's a decrease in dopamine. But what studies are showing is that before we even see those motor symptom changes, there are changes lower in the brainstem. So the dorsal nuclei of the vagus nerve is affected. And then it seems to kind of creep up the brainstem, affect more nuclei, and then we see that decrease in dopamine. And by the time someone's showing those motor changes and they go to their doctor and say, I need an assessment, they've often lost 80 to 90% of their dopamine. So it's huge. And that's why I think some researchers are trying to figure out how can we diagnose this earlier. But then we don't just see motor changes. We don't just see there's rigidity, the tremor, the postural changes, the bradykinesias. Bradykinesias are that slowness to initiate movement and the slowness of repetitive movement. We also see changes in smell, the GI tract, cognition. And so it really is a whole body disease, and we have to take that into consideration. And as you start to work with these clients, you'll see a lot of my clients complain of constipation or, memory loss. So if you're working with these clients and you notice a lot of them have constipation, change in their smell, change in their cognition, like memory and attention, that's really common. And those are things to track. And sometimes we're on the front lines and we notice these symptoms before they have a diagnosis, and we can maybe say, these are often linked to PD. Maybe you should go see a neurologist. And that can be helpful for diagnosis as well.
I'm really interested in something you said, where you said that like 80 to 90% of their motor function, it can be impaired by the time they go in. Is it because it happens so quickly where it's like, wow, when it goes, it's gone? Or is it because they feel like so many of the things that are happening can be attributed to other things? Like why is that such a large decline by the time they go in?
So the 80 to 90% was the dopamine loss.
Oh,
that's
okay. I was sorry.
The amount of dopamine. But
gotcha.
You're right. It's more than just that. So then there's more to the story. It keeps progressing. And then it's the midbrain, and then it's the neocortex. The limbic system is affected. So people sleep and their mood. And if you work with this population, you know this. You see these symptoms, and you hear these complaints. And then there's Lewy bodies that are associated with most people with Parkinson's. And whenever you have a lot of cell loss, there's the Lewy body collections as well. And then some of our clients end up with dementia. And it's really complicated. And I just think it's important to remember it's more than dopamine.
Yeah, it just feels and sounds like a really cruel disease. It just feels like it's unpredictable. It affects everything, and it's progressive. So it's like, gosh, it just feels really like a huge challenge.
It's rough. There's just so many things people struggle with, and it's a cycle. So like if you have short-term memory loss and you have to take your pills within a really short time frame, like the medication, the levodopa is really specific times throughout the day, then that's a struggle and you suffer because of it. And then you might fall and then get hurt. And then, it just kind of goes from there. So it's really important to stay on top of everything. It's really important for us as clinicians to advocate going to physical therapy, going to neurology checks, asking, do you think your neurologist might want to switch your medication up or whatever, and just helping them through that process. It's a lot for them to manage.